So I'm interested in Parkinson's disease because that's actually my largest clinic population. And every week I get a reminder of how significant these problems are and really the difficulties that our patients and families face. And that's a large, really the most important component of why I'm interested in this problem. Our group is primarily interested in determining what exact features of, or what exact changes in the brain underlie specific features of Parkinson's disease. So why do people have problems with their balance or falls, or why do people have difficulties with their thinking? And the idea there is that if we understood those specific changes, then that would be an avenue to actually try and develop better therapies. The hypothesis is that we're working on is that a change in the brain which already has some existing potential drug interventions is actually important in this process. So if we have good evidence that's going on, then we could actually translate fairly quickly to a plausible intervention. So the imaging methods allow you to actually, they're sort of a direct window into the brain processes as opposed to having to indirectly infer things from pathology. I see our research as helping other investigators in a couple of different ways. One way is that the methods we use are fairly distinctive to our group. So, our eventual goal is to make our data available, and consequently other people can use that data. The methods that we use are methods that are not widely used, so if they are found to be useful, they can be taken up by other people. And if we're correct about some of the ideas that we have, then this would be a point of departure for a lot of other work, both in terms of human work and actually even some basic drug development work in this area, that we would provide the justification for opening up a relatively new area of pharmacology for Parkinson's disease. Our goal would be to find a treatment to slow the progression of the cognitive problems in Parkinson's disease. And there I think the goal would be as Parkinson's patients live longer, in fact we have an older population which may be getting more Parkinson's disease, we would be able to mitigate the burden of that particularly devastating feature. In addition, if this worked in Parkinson's disease, this might actually be generalizable to some other serious neurologic diseases like Alzheimer's disease. Patient participation is crucial because we are doing clinical research and we need people who are willing to participate not just in a single study, but actually in studies that take place over several years' time, and who are willing actually to spend a fair amount of time allowing themselves to be examined by a variety of different methods. And we really need that complete set of data in order to try and answer the questions that we and other investigators are trying to address. The two things I would add are, first of all, this is really a team undertaking in several different ways, and it's a partnership between us and the patient community. And the second thing, it's a team undertaking with a lot of other investigators, both in my particular institution, but also everywhere else who are interested in this kind of problem. And it's really great to be in a very collaborative discipline.